Savannah. I'm a dermatology PA. I've worked as a physician assistant now for the past 6 years. Am I happy with my job? Yes, 100%. Did I think about going to medical school or becoming a doctor? Yeah, 100%. I think for most of us who become PAs, we at least thought about medical school or nursing at some point. I don't think there are many kindergartners who are writing that they want to be a PA when they grow up on their little first day of school bulletins. But for me, I knew I wanted to be in medicine. I wanted to be in healthcare. I wanted to be taking care of patients one-on-one. My sister had some medical issues growing up, so that's where my love of medicine came from, because I saw her struggles and I wanted to be able to help more. Once I got to high school and started really thinking about my career, I had to make some decisions, and I didn't really know what PAs were. My dad had gone to a doctor's visit and seen a PA. He came home super excited about this job and thought it would be a perfect fit for me, but I wasn't sold. And as a high school senior, I didn't really care. So I took that with a grain of salt, put it in the back of my mind, and went off to UGA. At the University of Georgia, I was a pre-med biology major. Pretty stereotypical, didn't know exactly what I was doing, but I signed up for all of the biology and chemistry classes like I was supposed to. At the University of Georgia, I entered college as a pre-med biology major. Pretty stereotypical, but I wanted to figure out where I wanted to go and what career would be the best option for me. So I signed up for all of the biologies and chemistries like I was supposed to, and I spent freshman year doing a ton of soul searching and also internet searching. I over-researched everything, and I definitely took a lot of time to look into anything I could do with a biology degree. PA, physician assistant, that sounded okay. Med school, dental school, DO school, nursing, nurse practitioner, physical therapy, occupational therapy, respiratory therapy, research, advising, you name it. And at the end of freshman year, I decided that nursing probably wasn't for me. I wasn't excited about being an RN. I wanted more involvement in the diagnosis of patients and really the treatment and understanding those things. Also, I already had a year of my bachelor's degree under my belt. It didn't make sense at that point for me to switch to a nursing path. I didn't want to be in people's mouths all day, yuck. So dentist was out. Some of my best friends are dentists, but not for me. I really felt like I wanted to be one-on-one with my patients in settings where I was able to treat them. So that left PA and med school. What was I gonna do? How was I going to make this decision? The pre-med and pre-PA paths are very similar, but there are some key differences, particularly when it comes to experience. For PA, you need a lot more patient care and direct healthcare experience, whereas medical school wants you to have some research and publications. And so I needed to really make that decision. The testing is also different. The prerequisites are different. I actually have a video on prerequisites for PA school, so make sure to check that out. But I wanted to make sure I was being as efficient as possible and doing everything I could to set myself up for success. My next step was shadowing, which I highly recommend. If you are interested in any medical or non-medical profession, spend some time with people who do it every single day. I was very fortunate to shadow both a PA and a doctor, and them both as a team. So they worked in hospital and wound care medicine, and they worked at different hospitals. The days I spent with them, sometimes I was with the PA, sometimes I was with the doctor, and sometimes we were all together. But doing that helped me to get some clarity about my future goals and what path I wanted to take, what was important to me, and getting to see those roles working with patients and working with each other is what solidified that the PA profession was exactly what I was meant to do. I love teamwork, I love collaboration, I love learning, but I also wanted to get out there and work. So I was not excited about the possibility of 7 to 10 more years of school. Looking at, adding on 2 to 3 years after school sounded a lot better. I also didn't know what field I wanted to go into. And even though it was a long way away, the idea of having to choose a residency very early on and choose a specialty was a little daunting for me. Another reason that I ultimately chose PA has to do with the competitive nature surrounding the pre-med community. At UGA, our classes were huge. They were 300 plus people, and there were definitely some cliques and some attitudes that I just did not thrive in. So knowing that that could translate to medical school where things are sometimes competitive was very stressful for me. I felt a lot of anxiety about having to compete with my peers. Talking to PAs and PA students, I found that for the most part, there was a sense of family and helping each other and support that comes along with PA school. Once I got to PA school, I can confirm that that is completely true, and I loved my PA school experience. Flashback to the end of freshman year, and I was set on PA school going into my sophomore year. At that point, I completed my prereqs, did patient care experience as a CNA, I got shadowing hours, lots of volunteering, lots of leadership, took the GRE, applied to PA school, got in, and here I am, a dermatology PA. On the flip side, my high school and college boyfriend ended up going to medical school. So I have an interesting perspective after seeing both paths. And he is completely happy doing what he's doing. I'm completely happy doing what I'm doing. And one thing I want you to know is along the way, we both had people question our paths and ask us about why we were doing certain things or making the decisions we were. Ultimately, you have to make the decision of what is going to be best for you. Healthcare is so big and we need everyone on the same team. So whether you're a PA or a doctor or anybody else, a nurse, a PT, an RT, an OT, you are valuable and you need to choose what's going to make the most sense for you. So looking back, 6 years after I graduated PA school, would I do it all again? Would I make different choices? I absolutely would choose becoming a PA again. The one thing I would do differently would be choosing a different major. I was a biology major and you can't do much with that. It also meant I ended up having to take some extra classes that I didn't really need, and I wish I used that time to take classes I was interested in. But that's just me. I would 100% choose being a PA again. I love my profession. I love the flexibility. It's very often ranked as one of the top professions in the US for a lot of reasons. There is a high job satisfaction for PAs, as well as the path to get there. It's hard. You have to do a lot. You have to sacrifice a lot, but ultimately it will 100% be worth it. You will have a career where you will be able to thrive. PAs are so unique in that we all have the same job title, but our jobs look so different. Even two of my really good friends from PA school who also work in derm, we do different things. We have different schedules, but we have the same title. And I love that if for some reason I got tired of derm, which I doubt because I love it, I would be able to find a job in another area, whether it was surgery, which would be my top choice, or my next choice, endocrinology, or anything else. I could take the general knowledge I had from PA school, refresh it for sure, and then jump into a new take on my career. So I highly recommend you spend time researching, shadowing, talking to PAs. My door is always open, or I guess I should say my inbox. So DM me on Instagram at the PA platform or shoot me an email, and I'm happy to help guide you in making that decision. And I never want you to feel forced into a career, but ultimately you do have to make a decision at some point, and I hope you choose whatever path you think will be the best for you.